The Board of Trustees of the and Foundation Board of the Princeton Healthcare System. He's a founding member and Healthcare Committee Chair of the KCCP. His medical school was at Cornell University Medical College, and his residency was in Brigham and Women's Hospital in Internal Medicine in Boston. And he had a fellowship in hematology and oncology at New York Hospital, Cornell Medical Center in New York. And today he'll be speaking on cancer screening and prevention.
Thank you. Thank you very much. It's hard to follow the talk given by Dr. Hyun. That was fascinating. It was great. Thank you. It was wonderful. Okay, so I'm just going to talk about first of all, the incidence and prevention, and as well as the detection for the cancer in Korean American population. Now, we hear a lot about cancer incidence in Korea, as well as in the United States, but we don't really a lot of time talk about Korean American population, because we are kind of unique population, and there's not been much studies. So I want to talk about our community and what it means. So let's present the data. So interesting is there is one article that I found published by Joanne Lee, who's from Cancer Institute in New Jersey and medical school at Robert Johnson, published recently in 2007, who studied the cancer incidence among Korean Americans versus the U.S. population and compared to native Koreans, and found a very interesting observation, and that applies to our population. By the way, I'm going to also talk Korean at the end for about 5 minutes, so just bear with me. What they have found out, the cancer incident rate for 100,000 raised by male, interesting was for the white U.S. population compared to Korean American population U.S. here and native Korean population. It turns out, as Dr. Rowe mentioned earlier, Korean population in Korea has very high incidence of stomach cancer. Rate is 70. But if you look at white Americans, stomach cancer rate is only 7. So in Korea, there's 10 times higher stomach cancer. But if you look at Korean Americans in population recently, our rate went down from 70 to 30. So by immigrating to the United States, we lowered the stomach cancer rate by half, which is good. And if you look at lung cancer, the rate in Korea is 47, Korean American 35, white population 51. So hopefully that translates to Korean Americans smoking less. And prostate cancer is rare in Korea. There's 6 in Korean population. In the United States, in white population, 118. And that's prostate cancer is the most highest cancer rate among U.S. populations. But if you look at Korean Americans, the rate also goes from 6 to 30. And still lower than U.S. population, but rate is going up, opposite to stomach cancer. The other one is liver cancer. In Korea, there's incidence 45, because due to very prevalent hepatitis. And in the United States, rate is 5, but also the Korean American rate goes down from 45 to 23. But also interesting, as Dr. Rowe mentioned earlier, is the colon and rectal cancer. In Korea, rate is 14, Korean American 35, U.S. population 39. So coming to the United States, Korean American rate of colon cancer is almost same as U.S. population, and almost 3 times higher than in Korea. And also, so it's interesting, it's opposite to the finding in stomach cancer. So as we came to the United States, as we adopt our different lifestyle, different food, and our rate of colon cancer, rectal cancer goes up, and our stomach cancer rate goes down, and our prostate cancer goes up among men. How about women? In female, the number was studied again. It showed that same is true for the breast cancer. In Korea, rate of breast cancer is 15. In the United States, white population, 109. But look at Korean American rate is 42. So again, rate almost 3 times was up. And but look at the stomach cancer rate. In Korea, rate 25. In U.S. population 3, and Korean American rate is 15. So again, the incidence of stomach cancer among women in Korean American rate goes down again by coming to U.S. That same finding for the male for colorectal cancer is true. Then in Korea, rate is 6 and goes to 22. That's almost as high as white population for incidence of colorectal cancer among Korean Americans. Again, this reflects the change in lifestyle, and which we'll talk about in a little bit more detail. But in general, when you talk about just the cancer rate, how about just overall cancer when you combine all the rate? Actually, when you look at the data, Korean Americans' rate of cancer rate is half of that of a U.S. population. So in general, Korean Americans are healthier in terms of cancer rate is concerned, but there are other incidences much higher. So when we talk